Hello everybody, I hope you had a great day. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going to talk about meniscus tear treatment tonight. So, very common to have a meniscus tear. Maybe you've had an MRI or had some pain with running or cutting and you have been diagnosed with a meniscus tear. It is not uncommon. The size of the tear really depends on how long it's been torn, exactly what you did, but it also, that size of the tear also determines exactly what you do for treatment. So if you are an active runner, skier, a lot of times they'll go in and surgically repair a larger tear just so you're able to continue to do those activities. If you're someone who has a smaller tear, which is what most people have, they will not go in and surgically repair it. They'll recommend a course of physical therapy. Sometimes it can actually heal, and it can get to the point many times, most times actually, if you complete the course of physical therapy where you don't have pain anymore with that meniscus tear. So meniscus tear pain generally is felt when you plant your foot and then you turn. So something where you're planting and turning, that can be a number of things, whether you're just kind of moving around in the kitchen or you're running and you go to change directions, or you're skiing, like especially moguls where you're stopping and going in different directions. But this type of planting and turning, not really going to feel it when your leg is not fixed to the ground, so you're not going to feel it like when you're doing anything that is involving your leg like this. It is really that pressure that you have when you stand on it and then you try and turn. You'll get a sharp pain. Sometimes you can get a click, but it's a very painful condition to have if you have it. So there are a few things that you can start to do at home if you are dealing with this meniscus tear. The idea is you want to make sure that you are taking the most amount of pressure off of that meniscus. You want to make sure that your muscles are strong and stretched out so that they are able to equally put enough pressure on that meniscus. Any type of weakness or any type of tightness is going to cause some undue pressure on that meniscus, causing that tear to get worse or to even cause you a lot more pain. But meniscus tears you're usually not going to feel when you're walking or maybe going down the steps. So if you have that type of pain, I'm not saying you don't also have a meniscus tear, but you will also have some other thing going on. And whether it's a tendonitis, that's a whole other video that you can watch. But some of the things that you can do at home right away is you want to put ice on it. If you've got pain, especially that sharp pain that can be associated with a meniscus tear, you want to ice that for about 15 or 20 minutes. Then we want to do some strengthening exercises or foam rolling exercises. If you refer to our YouTube channel, Total Performance Physical Therapy, you'll find several exercises on foam rolling, whether it's the whole leg, but you want to make sure you're really rolling out the whole leg to make sure that those muscles are nice and loose and stretched out. The next thing you want to do is more of a single leg balance. So you're just going to stand on this one leg. This is going to allow everything to really remain strong and balanced, which is why you're standing on one leg. If this is really easy, you can close your eyes and then you can put a pillow underneath your foot. There's ways to make this much more challenging. The idea is that you want to stand here for 30 seconds without falling, without touching anything. So if you're able to do this with your eyes open for 30 seconds, then go ahead and close them. It's a good one to do when you're brushing your teeth in the morning. You have the counter there, so you're easily able to pick up that foot. That's going to allow, again, a lot of that balance to come back to the joint and to that meniscus and to the muscles. The next thing you can do is you want to make sure, again, everything is nice and long, so you can do a hamstring stretch. Preferably is a foam roll of the hamstrings, but if you've done that, you can sit at your desk, put your heel down, and then bring your chest to your toes. You don't want to slump forward, okay? So you want to sit up nice and straight and hinge forward at the hips. So you're going to try and reach your toes. In this manner, it's very difficult for you to actually touch your toes, so you just want to make sure you're sitting up nice and straight and trying to reach your toes. If you're really grabbing them, you either are very flexible or you're bending at your back, which you really want to try to avoid doing. The last thing you want to do is more of a strengthening exercise, and that's more of a squat. So you're going to start basically by just sitting, getting up from a chair, and then sitting back down. Now, what you don't want to do is you don't want your knees to come together, okay? So you want to maintain this proper squat position where your feet are shoulder width apart, and you're just going and sitting down, and then standing back up. If you need to use your hands in the beginning to stand up, You can put them on your legs and then stand back up, okay? Or if you get really good and you can just kind of touch down and stand back up, that's the idea. You want to do about 15 to 20 of those. When you get really good, then you start doing one leg. That's much more difficult, but that's really going to help balance the muscles around the knee, helping take the pressure off of that meniscus. Usually it does require some visits to physical therapy to get that inflammation calmed down, to get you back on the right track to feeling better. If you or someone you know is suffering with meniscus tear and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good day.